Hi everyone, this is Dr. Harikiran, consultant interventional cardiologist, MedOne Hospitals, Kompally. So today, on the occasion of World Heart Day, September 29th every year will be celebrated as World Heart Day to remind everyone to take care of their heart health. So as we all know, for the heart health, you need to check regularly your BP, sugars, cholesterols and other parameters to know how is your heart. So this year, World Health Organization has come out with a theme called Don't Miss a Beat. So you know that generally heart beats around 60 to 90 times per minute, and whenever there is dyssynchrony or irregular heartbeat, you will have some heart problems like fast heartbeat, which is called palpitations, or slow heartbeat, where you can have giddiness, syncope, like you can lose consciousness. So whenever there is irregular heartbeat, it is a indicator that you should meet a doctor. So particularly a cardiologist if possible. So based on that, you can get an ECG done, and based on the heart speed, whether it is regular or irregular or increased heart speed or decreased heart speed, we can find some cardiac abnormalities. And also on this World Heart Day, we request everyone to get their risk factors checked. So generally the risk factors for heart disease are BP, sugar, smoking, alcohol and also cholesterol levels. So for BP, you need to check your BP regularly. If you are already a BP patient, you need to check at least once in 2 to 3 weeks. And if you are not a BP patient, at least once in 2 to 3 months. And that too in a relaxed atmosphere. Whenever you did some exertional activity, whenever you are emotionally disturbed, obviously your BP will be on the higher side. So don't check your BP at those point of time, but always check your BP when you are relaxed. Even if your first recording is on the higher side. Higher side, what we mean is anything more than 140 in the numerator and more than 90 in the denominator. So if these values are crossed, you should recheck your BP after 15-20 minutes of relaxation. And if the second and third values are still on the higher side, it is an indication that you may be having high BP and you need to consult a doctor. Second thing is sugars. So sugars should always be taken care. Most of the times it is the diabetes which is a silent killer. So many patients, they are not at all aware that they are having diabetes, and after few years, once the heart or brain or kidney or liver, it gets damaged, only then with the symptoms they come out saying that, sir, I have never checked my sugars. So that is the reason you have to check your sugars regularly. So once you check your sugars, fasting sugar should be less than 110 milligrams per deciliter, and post or 1.5 hours after your breakfast should be less than 140 milligrams per deciliter. So if these values are met, it is an obvious indication that your sugars are strictly under control. But if you are already a diabetic and if your sugars are crossed these values, it is an indication that you have to either increase your drug dosages or increase your lifestyle habits, like controlling your sugar intake in the diet as well as doing more exercise. Small and frequent meals has to be taken for sugar control. And then the next risk factor for heart health is smoking. So any smoker should quit smoking as early as possible to decrease their heart disease risk. Even 1 cigarette per day is dangerous. And then the next risk factor is alcohol. So generally it used to be said that limited amount of alcohol, 1 to 2 pegs of alcohol is okay if you are taking it in a limited way. But these days some of the studies have shown that even that is dangerous. So better to quit alcohol completely. And then cholesterol levels. So in the cholesterols you have good cholesterol which is HDL, bad cholesterol which is LDL. So if the bad cholesterol LDL is more than 100 or if it is more than 130, it is an indirect indication that you may have cholesterol depositions in the body which are dangerous and which can form blocks in the blood vessels of the heart. So these things should be taken care, and HDL should be at least 40. Anything less than 40, good cholesterol, HDL is harmful. So you should always maintain HDL more than 40 and LDL less than 130 and if possible less than 100. So these are the precautions to take care in order to prevent any heart diseases. So already the patient has heart disease, if the patient has undergone an angiogram and then stenting or bypass surgery, they should always keep their sugars, BPs and cholesterol within normal limits, and also consult your cardiologist regularly at least once in 6 months to check your ECG, 2D echo if there is any fresh damage to the heart. So by doing all these things, you can take care of your heart and be heart healthy. Thank you.